equip our young people with practical, industry-relevant skills aligned with the demands of the evolving job market. We're also undertaking a review of the national curriculum to align with the OECD Future of Education and Skills Framework. This will make TVET education more adaptive and resilient. Mr. Speaker, to expand access to higher education and support balanced regional growth and meet the rising demand for quality tertiary education, we've entered international partnerships to establish two new public universities, one in Kentapor in the Bono East region, another in Jasikan in the Oti region. I'm happy to announce also that a grant has been sourced from China to establish a new public university in Damango in the Savannah region. Mr. Speaker, technical universities play a critical role in closing the skills gap and reducing youth unemployment by delivering high-quality, industry-aligned and practice-oriented training within a broader policy framework that stimulates labor demand. In this regard, government is going to establish 3 new technical universities to strengthen skills development, enhance innovation, and support national industrialization efforts. Mr. Speaker, the Teachers Housing Initiative is a joint effort involving district assemblies, Common Fund, Get Fund, NAT, and JESOPs. And the aim is to build 50,000 housing units for teachers. This initiative is called the Teacher Dabre, maybe a Teacher Beda. This partnership demonstrates our collective dedication to enhancing teachers' living conditions and boosting the retention of teachers, especially in rural and remote areas, and ensuring that teachers can live, work, and retire with dignity and security. Mr. Speaker, by prioritizing equitable access and expanding infrastructure, we're investing in human capital and laying the foundation for a Ghana where every child can learn, grow, and succeed. Mr. Speaker, our health system. By January 2025, our health system was under severe strain. Aging and deteriorating equipment, stalled hospital projects amounting to 15 billion Ghana cedis in liabilities, and growing workforce pressures had weakened service delivery. Over the past year, donor support to our health sector declined sharply from 19% of our total health budget to just 2.2% today, creating an annual financing gap of more than 2.4 billion Ghana cedis. The withdrawal of support from programs previously financed by partners such as the USAID exposed the vulnerability in essential supplies and services, particularly in remote and underserved communities. Faced with these realities, my government chose to act decisively. In 2026, direct government funding for health will account for about 72% of our total health spending. This is up from 56.8% in 2023. Core health allocations have risen to GHS 23.3 billion, and with national health insurance resources included, total health financing now stands at 34.7 billion Ghana cedis. This reflects our clear commitment to domestic financing and health sovereignty. At the same time, we have faced the growing burden of non-communicable diseases. Today, non-communicable diseases account for over 40% of all deaths in Ghana and remain a major cause of household poverty. To address this, the government established the Ghana Medical Trust Fund, otherwise called Mahama Cares. Mr. Speaker, this is the first nationwide financing mechanism dedicated to chronic and non-communicable diseases. Mr. Speaker, the National Health Insurance Levy has been uncapped. Claims payments are now timely, with facilities no longer waiting more than 6 months as happened in the past for payment to be made. We're also finalizing measures to increase provider tariffs by over 100% to reflect the realistic cost of health treatment. As a result of the increased trust, NHIS enrollment has risen from 57% at the start of 2025 to 66% today. Mr. Speaker, Ghana's health workforce density has risen from 16.6% per 10,000 people in 2025 to nearly 42 per 10,000 today, while public sector health employment has doubled to approximately 200,000 workers. And yet, significant challenges remain. At the beginning of 2025, when we took over, 103,000 trained health workers were still awaiting placement, employment, or enrollment onto the payroll. Over the past year, 13,500 nurses and midwives, along with hundreds of doctors and pharmacists, have been absorbed into the public payroll. Nursing trainee allowances have been regularized and restored. Application fees have been reduced, and the no-fee stress initiative introduced to ease access to training has been extended. Service conditions are being implemented to boost morale and retention. Looking ahead, government will expand recruitment and take necessary action to add more health workers onto the payroll. We will also correct the maldistribution of health workers through targeted incentives for health workers who agree to serve in underserved areas. Let me use this opportunity to appeal to our gallant health workers to accept postings to our underserved areas, seeing as it is a national call to duty, while we work to ensure that they have an enabling environment to do their work. Mr. Speaker, we'll also scale up specialist and advanced nursing training to match the country's changing disease profile. New post-basic nursing programs in cardiology, nephrology, endocrinology, and oncology will be introduced. While the two existing ones, emergency and critical care nurses, will be scaled up. At least 30 nursing training institutions will transition to competency-based degree curriculums, supported by new scholarship opportunities for PhD-level training for nurses and allied health professionals. Mr. Speaker, on health infrastructure, my government remains firm in its commitment not to abandon unfinished projects. We'll continue to retool facilities, strengthen emergency and disease surveillance systems, and ensure that health infrastructure is properly aligned with staffing, equipment, and financing. In 2026 budget, provision has been made to commence regional hospitals in Oti, Savannah, and the Western North regions. This will expand access to quality care. Aligned with the reset agenda, we're making strategic investments in local pharmaceutical and vaccine production. The government has allocated 50 million in seed funding to the National Vaccine Institute. And in 2025, a local manufacturer secured market authorization to produce snake venom antiserum right here in Ghana. We're also finalizing steps to implement an advanced market commitment to prioritize locally manufactured vaccines and pharmaceuticals in public procurement. Production of the tetanus diphtheria vaccine is expected to commence this year through a partnership with an Indonesian pharmaceutical firm. Disease control remains our priority in our country's immunization financing. We will strengthen immunization financing. In 2025, the vaccine budget for children and pregnant women was increased by 46%, exceeding the 171 million Ghana cedis. And this enabled Ghana to fully and promptly finance all its vaccines and reduce the risk of preventable outbreaks. In 2025, we also introduced the HPV vaccine to protect young women and girls against cervical cancer. Mr. Speaker, Ghana's HIV prevalence rate is estimated at 1.6%. And as I speak with you, there are about 350,000 of our countrymen and women living with HIV and AIDS. Mr. Speaker, although prevalence is low, some population segments and regions have significantly higher incidence than the national average. The Ghana AIDS Commission has been tasked with ensuring the availability of testing and antiretrovirals. This year, government This year, government will fully roll out a free primary health care program, removing all cost barriers at the primary level where it is most needed, while strengthening prevention, screening, and health promotion, especially for non-communicable diseases. The Ghana Medical Trust Fund will be scaled up, and access to advanced cardiac care, including cardiac catheterization services at Tamale, Kolebu, and Komfo-Anokye Hospital, will be expanded to reduce overseas referrals and position Ghana as a center for specialized care in the sub-region, in line with our medical tourism objectives. Mr. Speaker, the Ministry of Health is expected to issue guidelines to eliminate the unacceptable no-bed syndrome. Patients facing medical emergencies must be received and given help, if even under makeshift conditions. You don't need to have a comfortable bed to save a patient. No patient must be turned away from any health facility they report to. Mr. Speaker, but in the meantime, government will expand capacity by implementing the Rich Hospital Phase 2 project to increase the number of beds at the Greater Accra Regional Hospital. We will also continue and complete the Police Hospital project, and also continue and complete the La General Hospital. Mr. Speaker, in the Ashanti region, we will complete the Sewa Regional Hospital. We will complete the Aferi Military Hospital, and we will complete the Komfo-Anokye Teaching Hospital Maternity and Children's Block. Mr. Speaker, we remain on course to build a stronger, more resilient, and more self-reliant health system for all Ghanaians. Mr. Speaker, roads are a very important sector. We inherited a burden of significant financial obligations and structural pressures in the road sector that had accumulated over the years. As of December 2024, outstanding payments on road projects financed through the consolidated fund stood at 21 billion Ghana cedis. These were certified works executed by contractors across the country for which payment had not been made. In addition, indebtedness to contractors that was lodged with the Ghana Road Fund Secretariat and awaiting payment amounted to 5.43 billion Ghana cedis. This figure excludes accruing interest charges, which continue to compound the state's financial exposure. Mr. Speaker, beyond these areas, we inherited also contractual commitments, that is, signed contracts, totaling more than 104 billion Ghana cedis. These commitments represent signed contracts for road projects at various stages of execution, many of them without corresponding secured funding to guarantee timely completion. By the end of 2025, the Ministry of Finance and Roads had cleared arrears amounting to almost 10 billion Ghana cedis owed to road contractors. And we are steadily continuing to reduce the road sector debts. Mr. Speaker, the famous Big Push infrastructure program. This is my vision for a national infrastructure drive to restore critical national infrastructure. Naturally, the bulk of the money is dedicated to the road sector. We want to open economic corridors, create jobs, and reduce the cost of doing business. Mr. Speaker, as I speak to you, work has started on 50 major road projects that cover a distance of 1,144 kilometers. The total estimated cost of these projects is 50 billion Ghana cedis. Meanwhile, government is also completing 23 projects that were awarded by the previous administration but were not paid for. These projects amount to another 573 kilometers and are estimated to cost 15 billion cedis. So if you add that to the 1,500, it means about 2,000 kilometers of roads are currently undergoing rehabilitation as I speak. This is the biggest major investment in our road sector in the history of Ghana. Across all 16 regions, 73 projects are advancing with significant visible progress expected by the end of the year. Some of these include Tepamaban-Goso, the Kumasi Bypass Road, Swami Interchange and Local Roads, Sunyani Outer Ring Road, Sampa Jinijini Road, Techima Nkonsia Winchi Road, dualization of Winneba Cape Coast Road, Kwau Tafo Adosu Road, Dodowa Afienya Dawenya, Bintiri Nakwanduri, Tamale Outer Ring Road, Winchi Sola, Sola Wa, Bole Chache, Bole Town Roads, Navrongo Tumu, Tumu Han Lora, Atimpoku Ho Denu, dualization of Accra Aflao, dualization of Cape Coast Akrade, Dadieso Akontombra, to name just a few. Mr. Speaker, other feeder roads are Akosombo Jakiti Kudikope, Yeniam Junction Sedom, Apegosum Pakadan, Todome to Palime Gemini Road. Indeed, there are many others too numerous to mention. And as I said at the